Welcome. This is Dr. Terrence Baker coming to you from the studios of NABNTV. Today we have a special report and update on the Omicron infection that is sweeping the world. Yesterday, the United States of America set a record of 1.35 million known cases, new cases, of the presumed Omicron or Delta variant of the coronavirus. This record is very important because it magnifies the number of patients. It demonstrates the number of patients that are becoming sick. Some have estimated as many as 10 Americans per second. It's important that you recognize the signs and symptoms of this new Omicron. The most common symptom is a scratchy, irritated throat. Another common symptom is sweating while you sleep. These symptoms have not been seen in the past with Delta and other coronavirus variations, but are being seen and are unique to the Omicron variant. It's important to know that whether you're vaccinated or not, whether you're boosted or not, or whether you're unvaccinated, that the Omicron virus can be infecting you and your family. It's important to know that the other symptoms that you may experience are nausea and vomiting, body aches and pains, headaches, cough, both productive and non-productive, sore throats, which are mild but also the worst sore throat of your life, nasal congestion, sinus congestion, sinusitis type symptoms, and even red irritated eyes are being reported. It's important to know that if you have any of these symptoms, you must consider yourself to be infected with the Omicron variant, and you must shelter and quarantine until you can become tested. Testing is available in three forms. There's a home test, there is a PCR test, and there is a rapid test, all of which can test you and tell you that you are positive for coronavirus or not. But until you get your test results back, you must assume that you are infected. What we're seeing in the Baltimore-Washington area is many patients, when they get a stuffy nose, sore throat, body aches, they're assuming that they have a respiratory illness, and they are not seeking medical attention, and they are not testing. It's important to test to know, because otherwise you can spread the Omicron variant to your friends, your neighbors, the workplace. The workplace is becoming problematic because many workers are needing to shelter in place because they've either been exposed and they are following the 5-day rule, which says that if you're exposed but not sick, you need to quarantine in place for up to 5 days. On the other hand, if you are sick and have been exposed and your test is positive, or you just don't know the results of your test, then you must quarantine in place until you know that you're positive or negative. And if you're positive, you must quarantine in place up to 14 days. There are treatments that your primary care physician and your nurse practitioner can provide to you that can help to shorten the course. Medications like zinc, medications like vitamin D3, medications like Zithromax, Dicipramine, and other medications are being used to shorten the course of your illness. Also, in some states and some cities, monoclonal antibodies remain available to also help you to shorten your course of illness. Staying hydrated, eating reasonable, sensible nutrition. For some of you with nausea, that may be chicken noodle soup, crackers, and other yogurts and soft diets. For those of you that are simply sheltering in place for 5 days, waiting for that time of exposure to pass, normal, regular diet is appropriate. At all times, it's important to stay in touch with your primary care physician. It's important to stay in touch with what's happening at your workplace and with other members of your family. Omicron should be taken seriously. When it first was discovered back in November the 24th in South Africa, we thought that Omicron was simply a mild form of the coronavirus that would come and go without any serious injuries and limited deaths. However, we know that Omicron is quite serious, and even though many of you who are vaccinated will only have a short course, others of you who are vaccinated and unvaccinated, in fact, will have a serious, prolonged 14 to 25-day course. And some of you will even require admission if your heart rate goes above 100 and stays there, your oxygen saturations drop to 93% or less. You begin with nausea, vomiting, diarrhea, can't keep any food on your stomach, and dehydration becomes a concern. Some of you will need to seek medical attention in an emergency room setting. Also, if you develop a temperature persistent above 100.4, you may very well have a coronavirus pneumonia or a bacterial pneumonia complicating your underlying coronavirus, and you will need to seek attention to get a chest x-ray or a CAT scan of your chest to determine whether you have pneumonia and require IV antibiotics to assist you through that time, also supplemental oxygen. At all times, follow the rules of wearing an N95 mask whenever you're indoor and among others where you know or don't know their vaccination status. N95 masks are very important to preventing the spread of this disease. Maintain your social distancing of 6 feet or more when possible. Ventilate the workspace in your home environment to minimize the amount of virus that's in the air around you. Filtrate your air with filters designed to capture viral particles. Take your prophylactic and supplements as directed by your family physician. Quarantine when there's any suspicion that you may be sick so as to not spread this disease to others, including your colleagues at work and your family members. If you follow these simple rules, the chances of you coming through this and preventing infection of your friends, your neighbors, your relatives, and your colleagues will be reduced. At all times, we must continue to work as a family, regardless of where you are in the world, whether you're in Africa, Europe, America, Canada, Israel, Mexico, South America. It doesn't matter. We must all continue to work together. It's so important that during this time of stress, national stress, in which all the continents of the world need to work together to have a plan that includes vaccination, but also includes reopening the nations, reopening the schools, reopening our churches, and continuing our journey together as a family. For the purposes of this pandemic, we are a family, and together we must go through this pandemic. Only by working together, only by sharing our resources, only by coming up with a united plan can we continue to move through this pandemic safely. This is Dr. Terrence Baker at NABNTV, Doctors in the House. Thank you.
NABNTV, inspiring a new generation.